And we know, and you know particularly as members of the Health and Human Services Finance Committee, that there are lots and lots of public dollars going into a healthcare system. But as we listen to Minnesotans, those dollars are not necessarily serving our districts well, the geographic places of our state well, the people of Minnesota well. And we also know that they're putting a lot of their own money into the healthcare, their healthcare. And they're asking us the question, and I heard loud and clear from them this summer, why does it cost so much? And I'm not getting what I need in terms of care. So that's why we're here today. Senate File 1745 creates the Minnesota Commission for Equitable Healthcare Services. It is a commission of Minnesotans to look at this problem that we're experiencing together. And it also creates the means by which the state auditor can receive information from accountable healthcare entities demonstrating the use of state appropriations for their intended use. This is the work of Senator Dietzick, which I believe is very important. The Minnesota Commission for Equitable Healthcare Services will travel the state and meet people in their communities to gather their stories about how our healthcare system impacts their families, neighbors, businesses, and careers. The information collected directly from the public will guide the Commission's goal of discovering why so many Minnesotans can't afford to get sick or hurt, no matter what type of coverage they have. And recently we saw a news report that Minnesotans are experiencing high levels of coverage. But despite that coverage, they're still paying a lot of money out of pocket, and that out-of-pocket money is serving as a deterrent to actually getting care. We also know that because of consolidation of systems, that there are lots of places in the state of Minnesota now that are absent necessary and basic care. Experts from across the healthcare industry will advise the Commission on the technical and analytical aspects of our healthcare system and help connect the stories gathered from every corner of Minnesota to specific policy or financial decisions made within the healthcare industry. This process of discovery and forming connections will steer the Commission toward developing policies that will get Minnesotans meaningful access to healthcare. 30 years ago, Minnesotans were wrestling with the question of access to care and the cost of care. And as a result of that wrestle, they created a healthcare commission. And that 2-year process of a People's Commission led to the reforms that developed Minnesota Care. This summer and fall, I spent some time with Jim Koppel, who recently retired from the Department of Human Services. He was the first executive director of that healthcare commission. And he said, you have to just keep pushing on the door until it opens up, until the pathway for the reform that we seek and need becomes available. And he encouraged us, the legislature, to look again at the path that was created 30 years ago when Minnesotans came together to say, this isn't working for us. And they helped us find a better way. There was a Star Tribune editorial last weekend, not this weekend, but the weekend before, about the prior authorization legislation moving through this legislature. Prior authorization is an instrument used by the financial part of health insurance on a regular basis. And the legislation that's moving this session is not the first time we've tried to reform prior authorization, because it becomes a tool to deny necessary care. You know, I ran for office the first time after I took care of my mom at the end of her life, because the care that she needed was denied by the insurance industry. And it frustrated my family, and it's still happening. And the Star Tribune lauded the effort of the legislature to one more time take a look at prior authorization to make sure it was working for people. And I wonder why it is the case that we pour so much public money into a system, and then that system uses that money to deny care. Do we understand that relationship in a way, and do we have our hands on it in a way that we are delivering on the commitment that we have made to Minnesotans to create a healthcare system that serves them? I think that is the question I want to put to a commission of Minnesotans who have expert advisors from the industry so they can come back and bring recommendations to the legislature. We are wrestling all the time with facets of the industry that show up as problems for the people we represent. It shows up for the healthcare system itself. And if we look at this proposal as a system of discovery, as a means of discovery, as a means of transparency, and we work together, including those who are subject to the discovery, the inquiry, those who are working in the system, our trusted providers, I do believe that those Minnesotans can bring to us a recommendation or recommendations that will help guide our public policy making. And that is the whole purpose of this legislation. According to CMS, in 2022, Americans spent $4.5 trillion on health care. That's $13,493 per person. That's 17.3% of our GDP, and it's higher than any other nation in the world. And yet we know Minnesotans are not getting the care that they need. And some of the stories that I heard over the summer and fall are the stories I'm sure you're hearing as well. A man in Faribault calling the healthcare system a barking dog on a chain. I was at that with Dr. Mann. He was very eloquent in his description of a system that's no longer serving him. I heard stories from people in Albert Lea who can't get a primary care visit in the Mayo system anymore. So they're going to Iowa to get their initial primary care. One woman who testified that by the time she got the primary care she needed, she had a cancer that had advanced far enough so that when she finally did see the specialist said, "What took you so long? Your cancer's well advanced." That happened in Mankato as well. I sat in a living and dining room filled with families in the district I represent, of families who can't get access to mental health care for their children. They're all in St. Paul. They're in what feels like a desert. They can't get meaningful care. We have heard story after story this session about systems closing or services closing, Foston closing, New Prague closing, Mercy and Unity Hospital closing down units, Children's in Alina closing units of beds of care that people need. And it is happening around us despite our very best efforts. Legislative appropriations to Minnesota's healthcare entities are made without competitive bidding or auditing and with minimal reporting. We know how much the state pays healthcare entities to provide care, but we don't have much of a way of knowing how much money is going to the people who need care or how much of it is eaten up by company overhead. This bill is not meant to vilify healthcare entities in Minnesota. I know personally that there are good people working for them and they help people access medical care, but that doesn't mean we should continue to aid a system that is failing Minnesotans. This bill is about transparency. It's about collecting the needed information so that the Healthcare Commission can provide the legislature with quality recommendations that actually address the rising costs with the healthcare system. The Commission's work is discovery. We can't fix a system we don't understand. The Commission will follow the complex web of corporations, administrative hurdles, network constraints, and cultural biases in a system that forced too many Minnesotans into delaying or avoiding care altogether. And with that, I'm happy for your questions, and I hope to earn your support. Thank you very much for having me today.